How does genetic hyperlipidemia impact children differently? Have you ever wondered how genetic hyperlipidemia affects children in ways that are different from adults? This condition, especially familial hypercholesterolemia, is present from birth and can lead to very high levels of low-density lipoprotein cholesterol, often referred to as bad cholesterol. Unlike cholesterol issues that arise from lifestyle choices later in life, children with familial hypercholesterolemia inherit a mutation that disrupts the body's ability to clear low-density lipoprotein cholesterol from the bloodstream. This leads to a buildup of cholesterol in the arteries starting from a young age. The early and persistent elevation of low-density lipoprotein cholesterol significantly increases the chances of developing atherosclerosis, which is the hardening and narrowing of the arteries. This can happen much earlier than usual, sometimes even in childhood or adolescence, leading to premature cardiovascular disease and heart attacks. For children with the more severe form known as homozygous familial hypercholesterolemia, where they inherit the defective gene from both parents, the risks are even greater. They may develop symptoms like cholesterol deposits in the skin, tendons, and around the eyes, which can be life-threatening if not treated before the age of 20. In children, these cholesterol deposits can be visibly seen on areas such as the elbows, knees, and Achilles tendons. This visibility is less common in adults and often leads to earlier diagnosis and intervention. Because familial hypercholesterolemia is genetic and not influenced by diet or lifestyle, children requiring early medical evaluation and treatment. This treatment may include cholesterol-lowering medications like statins, along with lifestyle changes to help reduce the risk of cardiovascular issues. Early intervention is essential to prevent or delay serious heart disease. On the other hand, children with polygenic hyperlipidemia inherit multiple genes that moderately elevate low-density lipoprotein cholesterol levels over time. This usually results in less severe cholesterol elevations and a later onset of cardiovascular risk compared to familial hypercholesterolemia. These children may not need medication as early but still requiring regular monitoring to manage their cholesterol levels. Overall, genetic hyperlipidemia in children requires prompt recognition and management due to its lasting effects on cholesterol metabolism and the increased risk for early cardiovascular disease. This distinguishes it from hyperlipidemia that develops later in life due to external factors. Understanding these differences is vital for ensuring the health and well-being of affected children.